Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, some of the highlights. Today, Nigerian Medical Association adamant as doctors in Kaduna State continue strike. On our theme, we examine keeping the children safe amidst the COVID-19 pandemic. In Latin America, new center of the COVID-19 pandemic. World Children's Day was first established in 1954 as Universal Children's Day and is celebrated on the 20th November to promote international togetherness, awareness among children worldwide and improving children's welfare. Here in Nigeria, the holiday is celebrated by government and non-governmental organizations May the 27th. The standard practice is to select children from each school to participate in a match past to salute the state leader in the stadium in competition with other schools. And now with the COVID-19 pandemic, it's obvious that the match pass for children and other activities will not be taking place. In our theme today, we look at the safety of the Nigerian child in the COVID-19 pandemic. COVID-19 infections in Nigeria have continued to rise, with 276 new cases announced last night by the Nigeria Center for Disease Control, NCDC, which brings the total number of cases in the country to 8,344. However, 2,385 of the patients have recovered, with 249 deaths recorded. Of the 276 new cases, Lagos has 161, Rivers 36, Edo State 27, Kaduna 19, Nasarawa 10, Oyo 6, Kano 4, Delta and Ebonyi 3 each, Gombe 2, 1 each in Ogun, Ondo, Borno, Abia and Bauchi states. Let's take you through a breakdown of the figures by region, showing Lagos top with, of course, its numbers, 3,756, followed by Kano in the northwest, 923 cases. The FCT in the north central region maintaining the third highest in the country with 519 cases. Borno still leading in the northeast with 256 cases, Edo in the south-south with 218. Ebonyi now leads in the southeast with 36 cases. And in Bayelsa State, one COVID-19 patient has been confirmed by the state's Ministry of Health, bringing the number of confirmed cases to 12. The new case is a 48-year-old businesswoman said to be a resident of Yenagoa, the state capital. She had complained of fever, cough, lack of taste before a test was carried out, and she tested positive. The Permanent Secretary, Ministry of Health, Dr. Nathaniel Akpoku, describes the patient as the most cooperative COVID-19 patient, as she voluntarily gave information about her contacts and her location. Samples of all those who had contact with her have since been taken and are said to have been cancelled on self-quarantine. The Nigerian Medical Association strike appears to be having an impact in Kaduna State, as the government is deploying medical teams, including management staff, to public hospitals in the state to keep emergency medical services. Now, the joint health sector unions, including medical doctors and nurses, began their warning strike last week, Friday. This is in a dispute over salary deduction, improved welfare packages. The government had warned health workers against embarking on the industrial action, especially at a period when the state and the entire country is battling to contain the COVID-19 pandemic. At the General Hospital in Savantasha and Yusuf Danchosho Hospital in Tudunwada, the wards and emergency units were deserted.
When the strike suddenly just erupted, and we had some patients in the ward who were on admission. And when the strike erupted, there was just nothing I could do. Aside from my management and some few other management staff, we had to keep managing the few patients that are in the ward. We actually discharged most of them, and I think we have only one patient that's in the ward at the moment. The challenge we have there is that globally, if you look at what is happening, though there may be differences between us and the government, but the truth, if you have to look at the things, the reality on the ground, there will be a better way of actually negotiating for this, rather than striking at this very time when people are locked down and financial constraints and other issues wandering around the whole corner. It's not really easy. Most people cannot access private care, considering the locality we come from. So the workers, to me, we should find a better way of dialoguing with the government so that we can resume in the back to provide our services.
Well, joining us right now is Professor Adebayo Luger, Managing Director, Unilag Consult, and Professor of Environmental Toxicology. Is one of the contributors to a study, the preliminary evaluation of COVID-19, the differences and incidences on the continent, and he joins us now. We'd like to welcome you to the program on this very special day, celebrating our children in the middle of a pandemic. Let's begin by asking you what you think this COVID-19 has, the kind of blow it has dealt on the Nigerian child.
Thank you so much for having me. It's a difficult one for the Nigerian child at this stage, because children are told they cannot visit their parents. Learning has been brought to a stop. So it's a big problem. But we are the corner.
Okay, we're going to try to reconnect. We appear to be having a little audio problems there. But just before we connect again with Professor, let's tell you what's happening in Rivers State, where the government is relaxing the total lockdown that was placed in some parts of the state, even as it is investigating the alleged mystery deaths in Bonny Island. Now, already, the governor directed that blood samples be collected from the suspected cases of COVID-19 and tests conducted as a way of determining if recent deaths on the island are related to the coronavirus. The governor yesterday in a statewide broadcast assured all citizens of the determination of governments to get to the root of the alleged mystery deaths. However, the state says it's focusing more on ensuring that people follow the NCDC guidelines religiously by wearing face masks, keeping effective and physical distance between 1.5 to 2 meters from each other, completely avoiding touching of faces with unwashed hands and cleaning of surfaces regularly. However, all land borders, including exit and entry routes into Rivers State, remain closed, as no vehicular movement would be allowed, except those on essential services. I'm just told we have Professor Adebayo Luger back again. We do apologize, but we hope you can hear me and that we have better audio. You were talking about the impact to the Nigerian child.
Yes, I can hear you very well. I said, with regards to the Nigerian child, it's been a very unsettling time. The children are not in school. They cannot visit their friends. Families cannot visit families. And this is a huge problem. Therefore, it's very unsettling. But, I mean, things are changing gradually. There is the tendency that things are easing out gradually, and very soon, I'm sure they'll be able to go back to school and start learning again. We thank God for those opportunities of the other schools that have been able to move lessons onto virtual platforms, and that has really helped. But this is still not enough, because a large chunk of Nigerian children are not really getting any form of learning at this stage. It's unfortunate, but things will get better.
There is a lot of hope and optimism coming from there, because a lot of people have talked about the impact to the vulnerable group. If you look at the children living with disability, also some of the Amajiri children as well, and the girl child, you know, at such a critical stage as this, do you expect that government are looking into workable ways to get the children busy at this stage? And this is all the Nigerian child.
Well, at this stage, the work of the government is really cut out for them. Any government official now, particularly in the educational sector, we know there's a lot to be done. You know, particularly when you pick on the different vulnerable groups, if you pick on the Amajiris, and with the way different state governments are sending them from one state to the other, as if they are no longer citizens of the country. It's unfortunate. We have to stay together and we have to all grapple with this and solve the problem. We are one now. Humanity must be at play now. We cannot just say, this is not my own problem, this is your own problem. This is not the stage to do that now. We should stay together, make sure that the health and the education of the children is the focal point at this stage.
Professor, let's go to the preliminary evaluation of COVID-19, the study which you earlier sent to me. What were some of the outcomes, the findings on the differences in the spread of COVID-19 infections on the continent, Africa?
Okay, what we've done with that study is that as countries are about to start easing out the lockdown issues, we felt it is important for us to come together and do an evaluation, particularly to identify what are the practices that can be shared among African countries. Good enough, our results have shown. I mean, the outcome of the study is quite clear. Somehow, somewhere, it seems Africa has been spared of this impact, the major impact from COVID-19. The level of confirmed cases, the number of deaths, and the number of recoveries in Africa, I mean, when you compare that to other continents, it shows that in a way we've been spared. And we know it is not because we have better health infrastructure. We know it is not because the performance of our health people are better, but somehow along the line, things have been better across Africa. So we felt it is time for us to share that. From the result, what we have seen is that the northern African countries have been more impacted compared to other parts of Africa. After the northern Africa, particularly you take Egypt, you take Algeria, you take Morocco, and then South Africa. I mean, in terms of the northern Africa, except South Africa, Egypt, Morocco, Algeria, and Tunisia, they've been impacted more. South Africa as a country has also been impacted a little bit more. And West Africa, particularly Nigeria, Ghana also, we've had our own level of impact. And that is quite the situation in Africa. In terms of recovery, we found out that a number of countries in Africa have done a lot better than the others, particularly countries like Mauritius, Mauritania, Madagascar, Togo. Some of these countries have done a lot better, even Gambia and Senegal, because a lot of the people who tested positive, they've actually recovered. And these countries also recorded lower number of deaths. You know, I mean, for Nigeria, we seem to be doing not too good in Africa, actually. We seem to be in the lower bottom of the rack. So there is a lot for us to learn from these countries that have done a lot better than us. Because we have realized it is only by learning from ourselves that we will know what to do in this case. And the world, we may also eventually have to even learn from Africa, from some of the results that we are seeing now.
If you can, in just about 30 seconds, I know you mentioned some of the countries, Togo, Madagascar, Burkina Faso, doing better. Also in your study, it showed that they sort of utilized traditional methods to fight COVID-19. Do you think that also helped them?
Actually, it's a combination of so many things. One thing that stood out is the informal sector within the prescription method for drugs. It seems Africans are just going around and treating themselves, whether with orthodox medicine or herbs or any other form of medicine. And it seems almost all Africans have become pseudo-doctors one way or the other. It seems we are all telling ourselves, you have to use ginger, we have to use some other lemon or the rest of it, take hot tea and the rest of it. And that has been going on. And when people are a little bit sick, they just go on and use some form of medicine. They are treating symptoms. This is what we see to be happening across Africa. And that may be responsible for the low number of deaths and the high level of recoveries that we have found.
All right, we appreciate your time. I guess Africans are just really trying to stay alive. We appreciate your time, Professor Adebayo Otitoloju, Managing Director, UNILAC Consult, Professor of Environmental Toxicology. Thank you for joining us.
Thank you.
We have more on the COVID-19 updates when we return. Please stay with us. Welcome back, and to the COVID-19 pandemic impact across states. The Kaduna State government has extended the lockdown it imposed on the state to contain the spread of COVID-19 for another 2 weeks. But the 2 weeks lockdown will start as from June the 1st, 2020, according to the Deputy Governor who made the announcement in a broadcast. The 2-day window remained Wednesdays and Thursdays for now. However, from June the 1st, the relaxation windows will be extended from 2 days to 3 days. Over in the southeast, secretaries to the governments of Anambra and Delta states, alongside police commissioners of the two states, they've met to discuss the streamline and also harmonize strategies towards the management of both human and vehicular traffic on the foot of the Niger Bridge at Delta State axis. Some of the resolutions reached include shifting the processing points between both states backwards, strict adherence to the definition of essential services provided, amongst others. And now with Latin America, now the new epicenter of the pandemic, the World Health Organization is predicting that infections and deaths will substantially worsen in the coming weeks. The region has confirmed more than 750,000 cases and over 40,000 deaths. But grim reports of cities resorting to mass graves and low testing rates in the majority of countries have led to concerns that these figures are significantly underestimated.
Latin America now has more daily reported cases of COVID-19 infections than Europe and the US in terms of total cases and deaths. And Brazil is by far the most affected country in the region. A study by the University of Washington is warning that Brazil's death toll could climb 5 times to 125,000 by early August. After complying for months with their country's strict coronavirus quarantine measures, Bolivians in the city of El Alto are once again out in their bustling streets, going about their businesses. Previously deserted streets in the populous city adjacent to the capital were filled with cars, buses and vendors. Bolivia is amongst Latin America's poorest nations. As of Tuesday, it recorded more than 6,600 coronavirus cases and over 261 deaths. And in South Korea, more students are back to school, although the number of coronavirus infections are increasing in the country. The country reported 40 new cases, 37 of them domestic. Schools opened for kindergarten students, the 2 lowest grades of elementary school, middle school seniors, and second-year high school students. And Singapore's government has installed vending machines dispensing free, reusable face masks, the latest in measures aimed at preventing the spread of COVID-19. Residents can simply select the size of mask on the touchpad screen before scanning their identity card to collect the mask.
Joining us right now is Dr. Ado Mohammed, who's the Global Program Director, D8 Countries, the former Executive Director, National Primary Healthcare Development Agency, and he joins us right now via Skype. We'd like to thank you for joining us, Dr. Mohammed. Let's begin by asking your assessment of the rise or the spread of infections, and this is across member countries of the D8.
Yes, let me first start by saying good afternoon to Nigerians. And I know that people are really concerned about the number of cases, increasing, despite the efforts that have been put in place by the respective governments. I think we need to understand that when we say flattening the curve, because all countries are kept on referring to the fact that we want to flatten the curve. When we say flatten the curve, what does it mean? What it means is that the number of cases today should be less than the number of cases yesterday. And then subsequently, the number of cases in the next few days should be less than the number of cases in the previous days. So what are we really doing to make that happen? I think we just need to understand that it's a two-way responsibility, citizen and government. Now protocol guidelines have been set up in terms of social distancing, in terms of physical distancing, in terms of making sure that as much as possible we remain at home except when it becomes necessary, and then closing borders, and then restriction of movement across states and communities. In addition, we also have put in place the protocol for testing, tracing, and then treating. All these are meant to flatten the curve, but it will take some time before we start seeing effects of that happening. So I think hope is not lost. Let's, as much as possible, try to uphold and then comply with guidelines and protocols that have been set, that have been really set up by governments. So it's important that citizens should abide by those protocols, and should also ensure that we maintain a reasonable distance between each other. We should also make sure that we restrict movement except when it's necessary. So all these are things that will flatten the curve. And I believe that in the next few weeks we'll start seeing the effect of protocol, the guideline, and then the complying, the benefit of complying with this protocol. I'm sure people will be worried that yes, we've been almost 4 weeks into lockdown. We've been 4 weeks into complying with those protocols. But let's also not forget the fact that we are beginning to, when we started, we have just 2 testing centers in Nigeria. But now we have several testing centers. So as we open most testing centers, more cases will be reported, and then as people get tested, we'll see more positive cases, and then cases will increase. So as we widen the scope of our testing, we see more testings, more cases, and then we discover more cases, and then the numbers will be increasing. But after some time, the curve will flatten, and we start seeing reduction in the number of cases.
All right, if I might just quickly squeeze in, that's because we just have a few seconds before we wrap up, and that is leveraging on the relationships. What is happening on the level of the D8 countries to fighting this pandemic in just about 30 seconds?
Yes, on the level of D8 countries, we're an economic bloc, and we want to ensure that we have collaboration in terms of economy between the 8 countries. What we've discovered is that we need to cooperate, we need to collaborate, and then we need to support each other. So what we've done, we've had virtual meeting of all the health experts from the 8 countries, and we resolved that we're going to support each other with knowledge sharing. We're going to support the member countries with technical assistance. We're also, as a bloc, working on research and development towards working on possible drugs, and then also working on possible vaccine, because the whole world is looking towards identifying appropriate vaccine and then appropriate treatment for COVID-19. So the D8 bloc as an intergovernmental platform is also in that race to make sure that we get the appropriate treatment and also get the appropriate vaccine. In addition, we also have work on seeing how we can produce some low-cost effective ventilators in the event that that is required, for member countries. But we are working at just making sure that does not happen. We cannot afford to overwhelm our health systems. So we have to protect and prevent it happening. We'd
like to thank you. Thank you so much, Dr. Adam Mohammed, Global Program Director, D8, former Executive Director, National Primary Health Care Development. Thank you for joining us on the program.
Welcome.
Take responsibility in protecting your health. A message from the NCDC. Its website has all the information, statistics, and also the cases across states with regular updates on regulations and also several guidelines. You can take a look at the website. And also from the World Health Organization, it has growing updates. Indeed, with regards to the virus, each moment it keeps updating the number of cases as well, the number of deaths and the recovery efforts across the board. Our website, channelstv.com, has the latest news. All you need to do is log on, access the news, public, politics, business, sports, Africa, around the world, all at your fingertips. That is channelstv.com. That's the COVID-19 update. Thank you for watching. I'll be back with another update at 6 p.m. Until then, I'm Innocent Nwonka. Stay safe.